Welcome to the deep dive. Today we're going to be exploring this gene called CACNA1A.
Yeah, CACNA1A.
Yeah, CACNA1A.
It's a mouthful.
It is a mouthful.
Yeah.
So we'll be talking about how it impacts this condition called hemiplegic migraine.
Right.
And we'll be looking at a bunch of different sources for
Yeah,
this.
a couple of scientific articles and some personal stories.
Should be a good time.
Yeah, I'm excited. I don't really know much about it.
Okay.
I know it's a gene, but can you explain, like, what exactly it does?
Yeah, so CACNA1A is basically a blueprint for building a subunit of a calcium channel.
Okay.
And you can think about calcium channels like little doorways on the surface of your cells
Yeah.
that control the flow of calcium ions in and out.
Okay, so calcium, like in milk. Why is that so important for our bodies?
Yeah, exactly, like
Yeah.
the stuff in milk. And it's
Yeah.
actually super important for a lot of processes, but particularly in the nervous system, because calcium signals allow our nerve cells to communicate with each other.
And, that communication is what makes everything possible, like thinking and moving.
So CACNA1A helps build these channels that then allow calcium to do its thing
Mhm.
and send messages around.
You got it.
Okay.
And there are actually different types of calcium channels, and CACNA1A is specifically involved in building this one called CAV2.1 subtype,
Okay.
also known as the PQ type channel.
Why is the PQ type channel so important?
Well, these channels are highly concentrated in the brain, and especially in the cerebellum.
Okay.
And you can think about the cerebellum as kind of the control center for movement and balance and coordination.
Okay.
So those PQ type channels are very important for smooth, coordinated movement.
I see. So you can already start to see how CACNA1A plays a vital role in the brain.
Yeah.
But we also said that it's linked to this condition called hemiplegic migraine.
Mm-hmm.
What exactly is that?
Hemiplegic migraine, or HM for short, is a very complex type of migraine.
Okay.
It's much more than just a headache.
So what makes it different than like a regular migraine?
Well, so it's not just a bad headache, it's also temporary paralysis on one side of the body.
Oh, wow.
You might have trouble speaking, you could have vision changes, you could even lose consciousness.
That sounds very scary.
It can be quite scary.
And is that all connected to CACNA1A?
In many cases, yes.
Okay.
So mutations in that CACNA1A can disrupt those PQ-type calcium channels, and that can trigger these hemiplegic migraine episodes.
So it's like a glitch in the brain's electrical system
Exactly.
caused by this faulty gene.
Yeah, that's a great way to put it.
And we also mentioned earlier that CACNA1A isn't just active in the brain, right?
Yeah.
It's expressed in muscles, too.
Uh-huh. It's also expressed in your skeletal muscle, which is the muscles that help you move your body.
So this one gene impacts the brain and our muscles.
Precisely.
Okay.
And so mutations in CACNA1A don't just increase your risk of neurological conditions like hemiplegic migraine, but they can also lead to some muscle-related disorders.
Like what kind of muscle problems are we talking about?
So one example is this condition called hypokalemic periodic paralysis, or hypo-PP for short.
Okay.
And it's characterized by episodes of muscle weakness that are often triggered by things like strenuous exercise or even a high-carbohydrate meal.
So you could be like playing basketball, or you could be eating pasta and all of a sudden experience muscle weakness.
Yeah, essentially what happens is these CACNA1A mutations disrupt the balance of electrolytes in the muscle cells.
Oh.
And that leads to temporary episodes of paralysis.
That's scary. And what other muscle conditions are linked?
So another one is malignant hyperthermia susceptibility, or MH.
Okay.
And this one can actually be life-threatening, and it's triggered by exposure to certain types of anesthesia during surgery.
So you'd have to be very careful about surgery if you had a CACNA1A mutation.
Yeah, absolutely. You should always inform your doctor about any family history of CACNA1A related disorders before having surgery.
That's really important information.
Yeah.
So, okay, so we've established that CACNA1A mutations can lead to hemiplegic migraines,
Yeah.
but also muscle disorders like hypo-PP and MH. It's amazing how much this one gene can influence.
It really is. And research is still ongoing to try to understand, the full extent of its role in the body.
Yeah.
But to get a better grasp on like the impact of this gene on everyday life, we should maybe delve into some personal experiences.
You mean like stories from people who are directly affected by CACNA1A mutations?
Exactly. So there was this recent study that focused on caregivers of individuals with CACNA1A related hemiplegic migraine.
Okay.
And the researchers conducted in-depth interviews with these caregivers to try to understand how these conditions really impact daily life.
I'm really interested to hear what they found because I think it helps us to understand the challenges beyond just medical terms.
Absolutely.
Yeah, so what did they find?
So one thing that they found was that caregivers reported a high incidence of apneic episodes during their loved ones' hemiplegic migraine attacks.
Apneic episodes, meaning that they stopped breathing.
Yeah,
Oh.
which is something that's not always mentioned in like medical textbooks.
But it's a very real and frightening experience that caregivers often have to manage.
It's a stark reminder that hemiplegic migraine isn't just a bad headache. It can involve some serious complications.
Yeah, exactly.
It must be terrifying for both the person experiencing it and their loved ones.
Yeah, and the study also revealed that caregivers face many challenges just in managing these episodes.
Like what kind of challenges?
Um, so for one, they described this constant need for vigilance, like they have to be prepared for emergencies at all times.
Right.
They feel like they're on high alert waiting for the next episode to happen.
That must be very stressful.
It is very stressful.
Yeah.
And they also talked about the difficulty of navigating the medical system and finding doctors who really understand CACNA1A related disorders
Right.
and advocating for their loved ones, in a world that often lacks awareness of these rare conditions.
It sounds like they're facing an uphill battle.
They really are.
Yeah.
And the impacts, extend beyond just the physical symptoms.
Yeah. Caregivers spoke about the social and emotional toll of these conditions and how hemiplegic migraines can disrupt, education, social
Right.
interactions, career choices,
Wow.
overall quality of life.
It's really heartbreaking to hear about all of the struggles these families go through.
It is. But one thing that stood out to me was the resilience of these caregivers.
What do you mean by resilience?
So despite all the challenges, they expressed this really deep love and commitment to their loved ones. They
Yeah.
were constantly searching for information, connecting with others, advocating for better treatments and more research.
That's very inspiring to hear that even in the face of so much adversity, they remain hopeful.
Yeah, it speaks to the strength of the human spirit.
Absolutely. And it reminds us that even though these conditions are rare, the impact on families is profound,
Right.
and we need to do more to support them.
Absolutely.
So where do we go from here? What can we do to help?
Well, first and foremost, awareness is key. The more people know about CACNA1A and its related disorders, the better equipped we are to recognize the symptoms, provide support, and advocate for more research and resources.
Knowledge is power.
Exactly. And for those who are directly impacted by CACNA1A mutations, early diagnosis and intervention is also crucial.
Mm-hmm.
By recognizing the early signs of an attack and administering the appropriate medications promptly, we can potentially shorten the duration and severity of the episode.
So being informed and proactive can make a difference.
It really can. And, it's not just about managing attacks, it's about preventing them.
Okay.
There are things that people can do to reduce the frequency and severity of these episodes.
Like what?
Well, some lifestyle modifications, such as, avoiding known triggers, getting regular sleep, managing stress, can all be really beneficial.
Yeah, that's stuff that everybody should be doing.
Exactly. But for individuals with CACNA1A related disorders, these lifestyle changes can be particularly helpful in managing their condition. And, in some cases, medications can also be used preventively to help reduce the risk of episodes.
So it's all about working with healthcare providers to develop a personalized plan that addresses that individual's specific needs.
Exactly. It's a team effort.
Mm.
And for families, dealing with the emotional and logistical challenges of these conditions, connecting with others who understand what they're going through is so important.
Yeah. Are there support groups or resources available?
Yeah, there are organizations like the CACNA1A Foundation offer a lot of valuable information support and a sense of community for those impacted by these disorders.
So it sounds like we've covered a lot of ground in this first part of our deep dive into CACNA1A.
We have.
We've explored its role in the brain and the muscles, learned about the various conditions it can impact, and heard about the challenges and resilience of those directly affected by its mutations.
Yeah, and in the next part, we'll delve a little bit deeper into some specific research and treatment approaches for CACNA1A related disorders.
Awesome. Can't wait to learn more. Welcome back to the deep dive. In part one, we were exploring CACNA1A,
CACNA1A.
and how it can impact both the brain and muscles.
Right, lots of different things.
And we also heard some really powerful stories from caregivers about the challenges of living with these different CACNA1A related disorders.
Yeah, their stories are really important to keep in mind.
Yeah, absolutely. And I think it really highlights the need for more research and better treatments.
For sure.
So speaking of research, what are scientists focusing on right now when it comes to CACNA1A?
Well, one area is trying to understand how different CACNA1A mutations lead to specific conditions.
Okay.
Like, remember how we talked about hemiplegic migraine, hypo-PP, and MH?
Yeah.
Well, it turns out that the type and location of the mutation within the gene can actually influence which condition a person develops.
So it's not just like, do you have a mutation or not?
Yeah.
It matters the specifics of the mutation.
Exactly. And so by unraveling, these connections, scientists hope to develop more targeted therapies that are tailored for each condition.
Yeah, makes a lot of sense.
Yeah.
So what kind of therapies are they exploring?
Well, one promising area is gene therapy.
Oh, wow.
So imagine being able to correct the faulty gene itself rather than just treating the symptoms.
That sounds like sci-fi. Is that even possible?
It's getting closer to reality every day.
Right.
So gene therapy involves delivering a healthy copy of the CACNA1A gene to the affected cells.
Okay.
And that healthy gene can then take over and produce the properly functioning calcium channel subunits, and that could potentially, reverse the effects of the mutation.
That would be huge for people dealing with these conditions.
That would be amazing. Yeah.
So what's the current status of gene therapy research for CACNA1A?
Well, it's still in the early stages,
Okay.
but the initial results have been encouraging.
Okay.
So preclinical studies in animal models have shown some really promising outcomes.
Oh.
And now researchers are working towards clinical trials in humans.
So there's hope on the horizon.
Definitely.
But what about in the meantime? Like, what are the treatments for managing the symptoms of these disorders?
Well, there are a number of approaches, and the most effective one really depends on the specific condition you're dealing with.
Right.
But
Let's start with hemiplegic migraine, since that's been a big focus of our deep dive.
okay.
What can people do to manage those attacks?
So the first step is to recognize the early warning signs of an attack.
Go.
Because the faster you can identify it, the faster you can take steps to minimize its impact.
So what are some of the signs?
Well, they can vary from person to person,
Okay.
but some of the common ones are visual disturbances like auras, tingling sensations, weakness on one side of the body, difficulty speaking.
And once you recognize those signs, what should you do?
Well, it's really important to have a plan in place with your doctor.
Okay.
This might involve taking specific medications at the onset of an attack to help reduce the severity and duration.
So what types of medications are usually used?
Well, triptans, which are commonly used for migraines, can be helpful for some people.
Okay.
Other medications like anti-nausea drugs and pain relievers can also be used to manage those symptoms.
So it's kind of like having a toolkit of different options to address the different aspects.
Exactly. And for some people, preventive medications might be recommended to help reduce the frequency of attacks.
Okay, so that's being more proactive.
Right. Exactly.
Okay, so we've talked about managing hemiplegic migraine.
Uh-huh.
What about the muscle-related disorders like hypo-PP?
Okay, so for hypo-PP, avoiding triggers is really important.
Okay.
So this might involve limiting strenuous exercise, avoiding high carbohydrate meals, and staying really well hydrated.
So lifestyle changes can play a role.
Definitely. And in some cases, medications like potassium supplements or carbonic anhydrase inhibitors might be prescribed to help prevent attacks.
Okay, well, what about MH?
So for individuals with MH susceptibility, the most important thing is to inform their medical team before any procedure that requires anesthesia.
So they can avoid those triggers.
Exactly.
Okay.
And in the rare event that an MH crisis does occur, there are specific medications and protocols that can help to manage that situation.
So it's all about knowledge and preparedness.
Yes, definitely.
And I think this brings up a broader point. The more we learn about CACNA1A and all its related disorders, the better equipped we are to develop more effective treatment strategies and improve the lives of those who are affected.
Absolutely. Research is an ongoing journey, and every new discovery brings us closer to better understanding and managing these conditions.
It's great to hear that there's so much progress being made.
Yeah, and I think this is a good place to wrap up this part of our deep dive.
Okay.
We've explored some of the latest research on CACNA1A, discussed various treatment approaches, and really emphasized the importance of individualized care and proactive management.
It's been fascinating so far.
Yeah, and in the final part of our deep dive, we're going to step back and explore the broader implications of CACNA1A research for the future of medicine.
Welcome back to the deep dive. This is the final part of our look at CACNA1A.
Yeah.
And we've gone through, the basics of the gene, the complexities of these different disorders, and heard a lot of really inspiring stories of resilience.
It's been a really fascinating deep dive, and I think it's pretty clear that CACNA1A is more than just a gene.
Right.
It's like this window into how the brain and body work.
Yeah.
And it's teaching us a lot about, personalized medicine and scientific discovery.
And it's amazing how far we've come in understanding it
Oh, yeah.
in such a short amount of time.
Right.
Like even a few decades ago, we barely knew anything about this gene, and now we're on the verge of being able to do gene therapy to treat these conditions.
It's amazing. It's a real testament to all those researchers out there
Yeah.
pushing the boundaries of what's possible.
And the patients and families who've shared their stories
Yes, absolutely.
and participated in research and advocated for more awareness and funding.
Huge shout out to all of them
Yeah.
because their voices have been so important.
Their resilience is inspiring.
It is.
So as we look ahead, what do you think CACNA1A research holds for the future?
Well, I think it holds a lot of promise,
Okay.
not just for developing treatments for people with CACNA1A mutations, but also for helping us to understand, the brain and muscle function as a whole.
So this could benefit more than just people with CACNA1A related disorders.
Exactly.
Okay.
Like, for instance, the stuff we're learning about calcium channels could lead to new treatments for other neurological conditions,
Like what?
like epilepsy or Parkinson's disease.
That's amazing.
Yeah, so it's kind of like a ripple effect
Yeah.
where one discovery can lead to so many more.
So what's next for CACNA1A research? What are scientists still trying to figure out?
So one thing is trying to figure out the exact mechanisms of how these different CACNA1A mutations disrupt, calcium channel function.
Okay.
And that's really important for being able to develop more targeted and effective therapies.
So going beyond just knowing what the mutation is and how it affects things at a molecular level.
Exactly. And another thing is developing better diagnostic tools for CACNA1A related disorders.
Go.
Right now, genetic testing is the best way to go.
Right.
But it can be expensive and time-consuming, and not everyone has access to it.
Yeah.
So, if we could have a faster and more affordable test,
That would help a lot of people.
it would allow us to diagnose people earlier and maybe even before they have symptoms.
And then intervene earlier.
Exactly.
So what about treatment options?
Yeah.
What are some of the promising avenues that you see coming up?
Well, like we talked about before, gene therapy has a lot of potential for, actually correcting the gene itself.
Right.
But it's still early, and there are some challenges.
Like what kinds of challenges?
Well, for one, we need to make sure that the healthy gene is delivered to the right cells
Okay.
and that it actually integrates into the genome properly.
And that it's safe.
And that it's safe, in the long term.
So a lot more to figure out, but the benefits could be huge.
Yeah, definitely. And in addition to gene therapy, researchers are also looking at other therapies like medications that could maybe modulate, the calcium channel activity,
Right.
or things that could target the downstream effects of the mutations.
So lots of different approaches.
Yeah, lots of different approaches.
And it seems like this collaborative spirit of all these different people working together is really important for moving forward.
It's super important. We need the scientists, the clinicians, the patients, the advocates all working together.
To make a difference.
Exactly.
Because it's not just about the science, it's about helping people.
Yes, well said.
So as we wrap up our deep dive into CACN1A, I want to leave our listeners with a feeling of hope.
Yeah.
Because even though these disorders can be challenging,
Mm-hmm.
there are so many people out there dedicated to finding answers and helping people.
It's a really great community.
And we've seen how much knowledge is power. So stay curious, stay informed, and stay connected.
Couldn't have said it better myself.
Thanks for joining us on this journey into CACNA1A.
CACNA1A.
And until next time, keep exploring.